My name is Rahee Amin, and I'm postgrad student in my gap year. Maya is not able to make it here today, but our project was on experience of deaf signing pregnant women and narrative review. Um, the objective of this research was to synthesize literature on healthcare experiences, barriers, and outcomes among deaf pregnant women globally, with a particular attention to those who use sign language. Before I continue the presentation, I do want to clarify what is the difference between capital G and lowercase d or hard of hearing. So capital G are individuals who use sign language such as ASL to communicate view deafness through social, linguistic, and cultural lenses and strongly value deaf culture and community. And hard of hearing, on the other hand, are the individuals who primarily use spoken language to communicate and often perceive deafness as a disability and tend to identify more closely with the hearing involved. So what are some known health outcomes for deaf and hard of hearing pregnant women? It's known, according to one paper, there are higher risks of chronic medical conditions and pregnancy complications, such as pre-existing gestational diabetes, and also higher adverse birth outcomes like pre-term birth. So why did we decide to focus on signing deaf pregnant women? When we were doing our literature review, we found a literature gap that a lot of the research kind of combines signing deaf pregnant women with non-signing women, and we know their experiences differ significantly. And of course, there's a reason for this because deaf and hard of hearing community is quite small, so small sample sizes often drive this grouping, but it kind of obscures unique challenges of signing deaf pregnant women. Some of the unique barriers are the language access and need for qualified and certified interpreters, culture navigations, deaf culture differences, and also overall visibility in research. So combining groups minimize recognition of distant challenges and reduce targeted intervention. Well, why does this exactly matter? Like as mentioned before, just being deaf and hard of hearing is already a risk factor for birthing disparities. And also for fewer studies specifically focus on sign language using pregnant women, creating a gap in understanding and care. So what are the known US-based deaf signing pregnant women experiences? Overall in US, the known barriers are inconsistent access to qualified ASL interpreters during prenatal and delivery care, providers lacking deaf culture competence and kind of relying on lip reading or family as interpreters, overall health information being inaccessible in an ASL and plain language formats, and also a need for constant self-advocacy just to secure basic accommodations. So what are some facilitators that make it better? So first of them would be consistent provision of certified interpreters across all appointments, provide a willingness to adopt communication methods, and patient-centered care teams that treat deaf patients as partners and not burdens, and also um, that community support networks like sharing doulas and online forums, and this can even include Reddit as care supplements, and having that support is very important. So what is narrative review is the most common type of articles in medical literature. It is less rigid than systematic review without it because it doesn't have a formal research methodology, search methodology. And why we chose it is because the timeline is shorter and it is less labor intensive and is usually intended to guide projects or interventions. And I'll be talking about the specific intervention at the end of the presentation. Gonna go over the briefly with methodologies. So overall, the literature search keywords were kind of related to deafness, hearing loss, pregnant-related terms, and this can include anything from prenatal care to maternal health and communication barriers. And we use PubMed and Google Scholars for instance. For screening methodology, the inclusion criteria was a focus on deaf women using sign language and not just on hard of hearing or combining in any other sense by the results. And the articles has to be available in English because we look at different countries, not just U.S. And the type of studies can include anything from qualitative to reports. And the time frame was 25 years. 20 years, my bad. And then exclusion criteria was everything opposite of that. So what did our flowchart or work look like overall? So we identified 40 articles, and out of the 40, by looking at the abstract, we decided to include 34 of them, but 6 of them we were a bit unsure on, so we decided to hold it before we make a decision. So we did a secondary screening on the all articles, but for 34 articles, we decided to include 18 of them and exclude 16 of them. And then for the final review, we decided to talk about the 6 articles because it was kind of unsure. Some of there was just like a little bit unsure about if it's really abide by our inclusion criteria. So some of them, we include 3 of them. So there, 3 of those were had a explicit focus on sign language and deaf pregnancy experiences, and 3 articles were excluded because they just didn't have an explicit signing language content or didn't really focus on pregnancy. And at the end, we decided to include 21 articles. And this is just a slide of all the articles that we decided to include. And if you skim it, you can see there is a diversity of countries and the papers overall. Moving on, I do want to talk about the preliminary themes that are emerging. So first theme is communication barriers and limited access. There are gaps in communication and lack of accessible prenatal resources contribute to adverse birth outcomes. Second is the positive impact of qualified supports, certified interpreters, and culturally knowledgeable healthcare teams significantly reduce prenatal disparities. And it also shows there's a need for sign language, specifically resources needed because not all deaf individuals are bilingual, and this in this context is ASL and or sign language or English or their native language, and prenatal information must be available in sign language. And there was the importance of community strength as well, because it's essential to develop that self advocacy and self confidence in signing that pregnant women. And I will be talking about some key studies, as you can see on the bottom, and how we decided to kind of group them. And there are some columns that just want to highlight some studies that we found very interesting. The first column is communication healthcare access. As mentioned before, and this studies kind of confirmed that women face significant communication barriers in prenatal care, impacting satisfaction and health outcomes, and interpreters and culturally competent care does improve communication and patient experience. And then moving on, the adverse birth outcomes in maternal care. Some studies did indicate higher risk of adverse pregnancy and neonatal outcomes among the signing women, and kind of confirms what is already known as well. And do want to talk about the intersectionality of it all. Um, Black deaf women experience compound challenges due to race and disability. And now this the next slide is where we'll be talking about the supporting evidence and best practices. One of the articles was on breastfeeding maternal practices, and this article talked about how deaf women using ASL, so resilience in breastfeeding supported by deaf community networks. And next column is mental health and screening, and this article essentially talks about accessible screening available in sign language is crucial for prenatal depression. And then the next slide, so best practice in case study. There were a couple of case studies that we decided to include and kind of highlight the importance of tailored care and creative use of sign language. And the next column talks about guidelines and recommendations. So what we do about those problems. So it kind of talks about sign language access, certified interpreters, and provider training to improve maternal care. So what are our next step on ongoing work? So we're working on refining, finalizing thematic analysis, and also developing final manuscript for publication submission. And I do want to spend some time on the implications. So this review is being used to identify and list resources for upcoming prenatal course done in ASL. And the course will be led by Dr. McKee and also Dr. Angela Earhart. Here are my references. And all right, thank you.